And welcome back to the show. Have you ever heard of melasma? It is actually the medical word for a tan or dark skin discoloration. It's sort of like freckles, but more uneven. It can affect anyone, but it's much more common in women, especially pregnant women. The nickname, in fact, and I remember this, is the mask of pregnancy. Sometimes those dark patches will fade, but what if they don't?
Wow, is there something you can do to get rid of the cosmetic problem? We asked the Wisconsin Vein Center and Medi Spa's Dr. Deborah Mangione. She's here to tell you about a new groundbreaking peel to help correct the damage. Welcome back.
Thank you so much.
So
first tell us a little bit now again, what is melasma?
Melasma is a pigment problem, hyperpigmentation within the skin. Usually affects people who have underlying darker skin tones, but it can affect anyone, and it is always associated with people who've been out in the sun.
Is it always just a I shouldn't say just, but it's a cosmetic problem?
It's a cosmetic issue, yes.
Okay. It's not painful?
No, not painful.
And sometimes it can fade. Can it go away completely?
Absolutely. You know, especially if you get it during pregnancy, very often it will go away after several months.
Okay.
And so, but in many people it is a permanent discoloration, especially prominent on the forehead, cheeks, or chin.
And I've seen it around the mouth.
Yes, you can see like a dark mustache.
Yeah,
absolutely.
exactly.
Yeah.
Is this something that can go elsewhere beside your face, like the speckles that you might get on your shoulders?
Some people have had, and this is usually people of darker color in other countries, do get little patches on their arms. But you know, there's sun damage that everybody gets as they age from cumulative exposure to the sun. And those are the spots and the freckles and what we call age spots. But then melasma is much more of a confluent, or you know, it blends together on the cheeks. So it can look really spotty, but it can also look like a great big brown patch on the forehead, cheeks, or some area of the face.
I was going to say it tends to be more patchy. And one of my best friends had the mask during pregnancy, especially around her forehead, was hoping it would go away, got pregnant with her second, it actually got worse. What I'm wondering is, for women out there who've been pregnant or who are pregnant and notice this problem, how long should they wait before they decide either to see a doctor or they decide, hey, this might be permanent, I'm going to seek treatment?
Several months, certainly. And especially because it can also be caused by hormone manipulation. So birth control pills can cause it. Hormone replacement therapy later in menopausal years can cause it. It's usually a combination of the estrogen and progesterone with somebody who's got a little bit darker skin tone or who's out in the sun a lot.
So then what can be done about these issues? Because obviously this is something that most people want to go away.
Right. Well, there are some basic things that can start with, and there are some prescription level medications that can be used topically on the skin that include azelaic acid, kojic acid, and some retinoin, which is going to help turn over the skin. And those products are very, very good, but they don't work for a significant number of people. And so then there are other procedures that can be done to help lighten it. And the problem is using things like intense pulse light, which is kind of a standard that we use for regular sun damage and dark spots, may actually make melasma worse.
Really?
Yes, and so only 50% of people may have some improvement, while the other half may have worsening. And so we're very, very careful in using that kind of treatment.
Yeah, I was wondering, do you sometimes do almost like a test?
Yeah, like a little patch test, you know, and as a spot that's not going to be as obvious. But then there are laser procedures that can be used. Again, they're not always as reliable as you'd like them to be.
So one of the things we keep saying is there's something new. It's a lot of people are considering it groundbreaking. I saw you yesterday and you said you're really noticing, or you're really hearing back from people that they're having really positive results.
And we're saying even a couple of years later. The first person we did it on was about 2 years ago, and she is still thrilled with the result. And that was somebody we had worked with for a year and a half, other light treatments, laser, and she had a little bit of improvement, but over several months would get worse again. And so this time, this has really worked. Now, what you have to know about melasma is once you have a successful treatment, the person has to be really committed to the program of avoiding the sun, using sunblock on a daily basis, even when it's not sunny out. Because women find that as they're driving in the car, for instance, the left side of their face gets much worse if they're the driver.
Even with the window up?
Even with the window up, even with the glass blocking the ultraviolet B rays, it's the ultraviolet A and the light itself which can actually make the melasma worse. So it really does take a commitment and a level of responsibility on the part of the person to do it. But now we have a peel that is what we call our advanced pigment peel at Wisconsin Vein Center and Medi Spa, which really works beautifully to help really reduce or eliminate the effects
so
of melasma.
talk us through the pictures as we put them up. This is melasma.
This is melasma, one example of melasma.
Where do we notice it? Around her mouth?
We notice around her cheeks and around her mouth.
Okay.
Cheeks and
all that dark area.
And chin. And this is what the peel looks like. Now, this is when we first placed it. And actually, we're using now a base that's a clear gel instead of the white creamy base.
Okay.
But this is placed on in the office. We mix it up right at the time the person comes in. And then the peel stays on anywhere from 4 to 10 hours, depending on the person's underlying skin color.
Does it hurt?
No, doesn't hurt at all. They
Doesn't
don't feel
hurt.
at all.
And it's better for people with darker skin, correct?
It works for everybody.
Okay.
It works for everybody as a brightening procedure. And then this is what it may look like the next day. So the person's going to be quite red, and then a few days later, I think we have another picture, it shows how you can get very peely. So you're going to
Yeah.
be red and have a lot of peeling of the skin. And so this is day 3.
But
molt.
this is
Right.
actually, you molt. This
Yeah.
is actually a positive thing. When you see that
Right.
peeling, it's good.
Yes.
Okay.
And then again, after the peeling's gone, you're still red for a while, but over the course of the next month, the redness gets
Wow.
lighter, and this is at 33 days with this person, and this is later. And the discoloration really is gone. Melasma is different from other pigments in that it can be in the epidermis, the highest layer, closest to the surface, and the dermis as well. And so it really takes a lot of effort to try to get rid of this level of
It looks
discoloration.
like it's worth it, though, because
It
you're
is
getting
definitely
some
worth
really
it.
nice results.
Right, and even people who have other pigment changes other than melasma, the same peel works very, very well. It's a peel that's been specially designed, with a pharmaceutical company that works with cosmetic procedures. They've helped design this peel, and it really works magnificently.
Well, a lot of people out there who are listening are probably interested in more information, so we want to make sure we get that to you. That's with the Wisconsin Vein Center and Medi Spa. They're in Georgetown. They're on Georgetown Drive in Pewaukee. The phone number is 262-746-9088, or you can go to wimedispa.com if you want to get more information as well. This is a groundbreaking peel. It looks like it really has fantastic results. So
Yes,
thank you.
it does.